Hi YouTube friends, it's Kate. Thought I would make this video and share a little bit about my second trimester with the TAC. I did not make any videos throughout the second trimester that documented week by week for many reasons. One, I just really didn't feel like it, and two, I had a lot of anxiety in the second trimester, which I'm sure a lot of you can either relate to or certainly understand. Um, so here we go. A lot of things I experienced were not necessarily due to the TAC. Um, at the 15-week mark, I was experiencing complications from a urinary tract infection, and I had to go in and get an antibiotic shot. And since I've been on antibiotics this entire pregnancy, not ideal for me, but it's what my doctor feels is best. And so I am continuing with that. So I was getting recurrent group B strep urinary tract infections that just they could not get to clear up with an antibiotic. And so then I ended up getting the shot and then came back. And so then I am on a dose of penicillin for the rest of the pregnancy. So obviously that doesn't have anything to do with attack, but something um, that I have experienced. So the big thing I think most people want to know in the second trimester is about the cervical length checks, and that is done via vaginal ultrasound. So at the 16-week mark, which actually was the day after I got that shot in my butt, I went in for my very first cervical length check, and that was pretty nerve-wracking. I took a friend with me because my husband was not able to make it, but I went in, and I mean, my cervix is really long. I can't tell you off the top of my head or remember what it was, but my doctor was very happy. One thing that I didn't quite understand that my doctor did explain to me is when they did the cervical length check, and then I met with my doctor afterwards, she said, "You even have cervical length above the cerclage right now, which is great." I was really confused by that because I said I thought that they placed this tack right at the very top of my cervix, so how can there be more above that? And she told me, not to freak out, that it's placed exactly where it's supposed to be, and that it's placed, as I know, many doctors say there's these certain ligaments that it needs to be placed above that, and I think regardless of how far up or whatever, I don't know. My doctor just said that there's a lot going on when they do this surgery, and getting proper placement is important, but that mine was in proper placement and not to freak out. So I'll get back to that here in just a couple minutes. So I went in for my 18-week appointment, which was I was just an emotional wreck because that was the same gestation that we lost our last baby. And I was having a hard time. I tear up thinking about how overwhelmed I was at that time. But again, everything looked good. Cerclage great, cervical length great. Um, and then I was sent home. So I had bi-weekly vaginal ultrasounds throughout 16 to the 28-week mark. So 16 weeks was vaginal ultrasound and doctor's appointment. 18 weeks would have just been a vaginal ultrasound. And then 20 weeks, of course, now goes to anatomy scan as well. So at 20 weeks, I had vaginal ultrasound, anatomy scan, and then also seeing the doctor after that. So, anatomy scan, everything looked good, and that was a huge relief. Also, cerclage looking great as well. Then we I actually saw the on-call doctor that day because my doctor was out on vacation, and met with her, and like it was really uneventful. 22 weeks, the same thing. Went in, got a vaginal ultrasound, cervix still looking good. And at each appointment, they always check on the baby too. And I've never had to ask, but they always, are checking heartbeat and checking on the baby, which is, um, I think, also reassuring going through a pregnancy after loss. Being able to go in every couple of weeks, that was just a huge anxiety relief. So then at 24 weeks, it was another vaginal ultrasound and a growth scan. I don't know if that is typical or not, or if they just did the growth scan because I was already there. So apparently they do growth scans once a month. But again, I don't know if in a quote unquote normal pregnancy, if they do that, or if it's like I was just already there, so they did. But at 24 weeks, we had another growth scan. Baby was measuring fine, everything was fine. And then 26 weeks, just a vaginal ultrasound, which was also fine. And then finally at 28 weeks, vaginal ultrasound, and then another growth scan. And again, everything was fine. So I made it through to the end. I have graduated from the vaginal ultrasounds, and I also did not need any progesterone therapy of any kind. I know that some women do, because I had asked my doctor that at the beginning of my pregnancy, and she said some women will end up needing progesterone and some will not. So, from my understanding, I think it uh, is if your cervix gets measurement is below 2.5 centimeters, then they do progesterone therapy as well. Mine never did. Uh, the lowest, I do know the lowest reading or measurement that I got was 3.5 centimeters, but then when I went back 2 weeks later, it was like 5 centimeters. And I, not that it grew or whatever, but I think it's just um, the angle in which certain, that they get the measurement. And I mostly had the same sonographer the whole time, but there was two incidences where I had a different sonographer. So I don't know if that makes a difference either, but moral of the story is my cervix has stayed nice and long, and also I didn't need progesterone, and more importantly, nothing was coming through um, the cerclage. They would press on my stomach to simulate contractions, I guess, and really they were looking to make sure that nothing was opening up. So there was never an issue. One thing I will say, going back to that 16-week appointment when my doctor said, "Oh, you have length above the actual TAC," that length did shorten over time. And at my last two ultrasounds, my baby's head is right on the cerclage. It's like cerclage, baby's head. And that's fine as long as it holds. And my doctor did tell me like that would happen. She said, "Your cervix is not going to stay this long the entire pregnancy. So, don't be freaking out if it gets shorter." And as the weeks went, like that that top part of the cervix did start to um, decrease, I guess. And again, I'm not a doctor, so I don't know if that's normal for a quote unquote regular pregnancy. I've heard some women mention something about like funneling with a TAC. I don't know if that means there's funneling with a TAC, but on all of my ultrasound reports, it's typed up my cervical length and then it says no funneling. So I have no clue. All I know is that everything has worked worked out, and I'm super grateful for that. One thing I want to mention about second trimester and going through this is the anxiety. Like I was just not prepared going through a pregnancy after loss, like about how like mentally and emotionally kind of exhausting it is, because up until probably like the 22-week mark, I was a mess, just like not having faith that this would work, or questioning, "Oh my god, is this working?" Because I was having like cervical like lightning crotch, and I was like freaking out that something was going wrong, and it wasn't. And eventually that just stopped. I have not experienced that in a month at least. So um in hindsight, I wish that I would have had a little bit more faith in the beginning of my pregnancy, because I was just so scared to do anything. I didn't even want to like, I was scared to like walk or exercise or like bend down to get something off the floor. I was just like petrified. But then when I saw the ultrasounds at 16, 18, 20, 22, and I can see, okay, it's holding, it's holding, it's holding, especially, I don't know why that 22-week mark, I've started to feel like, okay, this is going to work. And at that point, I started to I don't want to say be more active. I have not been as active in this pregnancy as I usually am outside of being pregnant. But I've had more faith that it was going to work. And so then I started doing some prenatal yoga and walking a little bit more. Nothing crazy. I still, and I know this is like totally in my head, I still don't feel comfortable doing any type of like squats, like exercising. So I was doing prenatal yoga and they're doing chair pose, and I was still kind of freaked out to do that. I've learned in this pregnancy that feelings override logic because my brain logically can understand that this is more likely to work out, but the feelings and the emotions kind of take over that. So I've just decided to appease the feelings and emotions so that I don't like have a freak out all the time. So things are getting better as things have progressed. So it feels like a huge, huge milestone to get to 28 weeks. And then from now on, I'm just having appointments like a regular pregnant person. So at 30 weeks, I have just a regular OB, and I'm just assuming they like use the Doppler or something on my stomach. And then at 32 weeks, she is going to do another growth scan. Again, I don't know if that's normal or if they're just like keeping an eye on me or what, but I will not say no to another opportunity to see the baby. Plus, they do the 3D ultrasounds, which is really cool to be able to see facial features and things like that. So also, my C-section is scheduled at 39 weeks unless I were to go into labor before that. So that's kind of the extent of the second trimester, and I will try to make a video encapsulating the third trimester and get that up as well. So see you guys another time.